week, you know, and on whether you do it today or tomorrow or next week, by Monday next week, when we're going to meet again on Tuesday, you should have all of these things together. So I want you to think about, you're going to name your committee. Who are the members of the committee? I want you to find 4 people in your organization, create a calendar, right? Pick at least one indicator that you already have data for, and then you're going to write out all the different parts of it. And you're going to decide who's going to be the chairperson, who's going to write the minutes. So I'm going to share with you. I have some templates that I'm going to share with you. And give me a second. I'm going to stop sharing for a second, and I'll show you the templates for data collection and also for your QI minutes. And then I'll take some questions. So give me 1 sec. So here, so here I have a worksheet, you know, how you build, building a quality improvement. It's a workbook, right? You have all the objectives and everything in there that you could use or that you will use, right? It tells you what the program it is, why the program exists. Sorry, I'm getting tongue-tied here. And, you know, the structure, and you can use it. You could just fill it in. So for example, you know, what role does your administrator hold? Who holds it? What's the name of that person? Write it in here. Who's your clinical lead? Write it there. And then on the other side, it tells you what their responsibilities are going to do. So you need to have someone who's going to take responsibility for it. So you, as you can see here, your HR person or compliance lead, you know, write that person's name, identify that person, and then you're going to assign this task to them. They're going to be looking at personal record screening, competence, and that kind of stuff, right? And then you're going to come up with your indicators. Just remember, you're going to need to structure the process and outcome when you're developing your indicators. When you think about the questions that, you know, your measurement you should ask, think about it. Why are we doing it? Is it, why are we doing the right thing? Are we doing the right thing? Right? Is it appropriate? And how well are we doing it? So think about those things, right? And then we have that sample size. So you can use this worksheet to fill it out. You could just plug and play and put in all the stuff. Here it has like all the different indicators set. How often I recommend that you do them. And you could just plug in what threshold mean, you know, the compliance rate that you want to set for the agency, and who's going to be that person responsible. Your administrator, your clinical lead does not need to be responsible for every single thing. Their responsibility is to oversee these things. So as the owner of the company, you're going to assign different things to different people in your organization and let them present it at your QI meeting, and then you question them about it. And you can have an open discussion, and then you set a calendar, right? So that's a workbook that I, you know, that we will also, that I want to share with you. And then I have one more tool that I would definitely would love to share, and it's the QI. Let me just get the, sorry. And it's the, oops, sorry about that. Sure. And it's your minutes, right? So your quality improvement committee, you're going to write your agency name, right? The meeting date, the time you started. Every single meeting, you want to do that. The time you started, the time you adjourned, what period or quarter you're looking at, who was present, what are their roles? If they weren't present, why? Who you excuse them. Did everyone agree on the minutes?
We're going Well, whatever was recorded, I'm gonna paste it into the, well, I meaning Nelva will will upload it to the community. So that will be available.
Okay.
The recording. I don't have meeting notes. I just the recording.
Okay. And so I do have the you could get the have recording. We'll also have the templates that everyone could get if they would love it, right? If they want it, I'm willing to I could have it to them for a minimal price. I have a QR code that I will share with you know with you, Dr. with everyone.
Mhm.
Um that if they want to purchase it, they could just scan the QR code and they could, you know, we have bundles where you could either just purchase the stuff for one session, or you could purchase it for all 4 sessions. If you decide that you purchase one now and you want to go, you decide that you're going to do all the four, you get credited for it, right? So that's our QR code. But at the minimal, you'll have the recording from Dr. Shannon.
Yes. Yes, it'll be uploaded into the community by tomorrow.
Uh,
By tomorrow.
Hi, I have a
Hello.
question. So you were talking about like a series, right? So are you coming back and doing more teachings, correct?
So I'll be here next week,
Okay.
Tuesday, and then we'll take a break because it's Labor Day weekend and it's a holiday weekend. I want to make sure everyone enjoy their weekend, but I'll be traveling. So,
Okay. Well,
and
I hope
then
you are you have some good plans. So you
yes,
said you were giving us some homework to do, correct?
yes, I'm gonna give you some homework to do.
Okay. And with those templates that you were showing us, would we be required to utilize those templates in order to do the
So
homework?
you could get the if you purchase you could purchase the templates, but at a minimal, I do have homework that I want you to think about, right? And I'm gonna send you the let me just share the screen
I
again.
think
Sorry.
excuse me, I think Alyssa is asking, would she need the template in order to complete her homework? I believe that's the
Absolutely
question.
not. You don't
Okay.
have to. You don't have to. Not at all.
Okay. Okay.
You could
Is
do
that
your
right,
homework
Elisa?
without.
Yeah,
Now
yeah.
you
I
don't you
do
need
have
you
some more
don't need the
questions around
templates.
quality improvement, but I think that we could probably address that at a next meeting after I kind of review the homework
Yeah, you don't have
and
homework.
look
Let
at
me
it.
share your homework with you. Hold on 1 second. Um, let's share the homework. See, I'm an educator, so I love to give homework.
Thank you. So I'm being sarcastic.
Uh, let's see, where is the homework? Um, da 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 da. Okay. Yeah, my students are not happy with me from time to time. But here's your homework, right? You could copy it down. You don't need a template.
So do a screenshot. Nova, do a screenshot of that, please.
Here's your
Oh,
homework.
okay. I could take a picture
And
with my
Dr.
phone.
Shannon, I could send you you could post it for everyone. Okay.
Okay, all right. Thank you. Thank you for that.
So just playing the devil advocate here. So let's
Mhm.
say that I'm newly starting out and I don't have a committee. I don't have 4 people. So can we imaginary kind of set this up, or do it have to be like real life stuff?
So if you're just starting, and how many people are in your organization?
I'm
Well,
I'm
we have a
I'm not
committee.
saying I'm just starting.
Mhm.
I'm not just starting. I'm just saying like
So
it
if
is some
if
people in the community that is just starting though. And so
so
just for
I would
them.
recommend I got it. So I would recommend that if you're your startup company, your solo practice is known with you, you're doing everything, right?
Mhm.
One, I would suggest that you get someone, at least an individual, to be on to be the what do you call it? The caregiver or the family member, the patient representative, whatever you want to call it. Someone that you know, right? And that's your person who's going to tell you, you know what, in terms of a patient perspective, this may be a good idea, not a good idea, and how, because they're going to look at it from a patient perspective.
Mhm.
right? So if you're a startup company, you're solo stuff, you may be the one person who's doing every single thing initially as an organization. If you're a solo practice, no one else is there with you. You're the coordinator, you're the clinical person. If it's a medical stuff, you're everything. So you're gonna wear all the hats. But I would suggest that you get another person who, has nothing. I'm sure you could find someone, not you, but whoever it is, who could be the voice of reason.
Mhm.
Excuse
So
me,
for your
Dr.
homework,
Dr.
go
Marcia,
ahead,
quick
Dr.
question
Shannon.
for so you're saying another person, but you would recommend that it's more than two people, correct?
I definitely recommend if when you have an organization, you need to have you need to have at least three, four people on this committee. I do understand that as a startup, you may not have those people, you know. So, you may be head cook and bottle washer, as the saying goes, that you're doing everything. But to have a committee, you really do need to have, a group of people
When I first started, I had volunteers.
at the minimal. That's what I'm saying.
Yes.
You could find someone, especially from the patient perspective, who's going to talk on behalf. That's going to be your advocate. And so for next week, let's say if you're in the community and you're the only person, just think about who you'd want to be on this committee, on your committee. Identify people who, you say, you know what, that'll be a good person. I know somebody who be, they're non-biased, they're gonna tell me as it is in terms of at least, from an advocate perspective, they're going to tell me, this is not, I'm not doing this right. It doesn't make sense. Someone who you could talk to and you things with, and who could help you in terms of when you're looking at, root cause. They could help you to really do a deep dive. You could even get together. I mean, members, in the community, if you're working by yourself, if you're have a solo practice, there's no one else. I don't know how you guys feel in terms of, getting together and talk to each other about, volunteering for each other's company. And of course, we always worry about sharing information, but there has to be some level of trust that you guys have amongst each other.
Yes,
Or
I
you
would.
could just talk
Yeah,
about best practice.
yes, I would
Yeah,
definitely encourage that for sure.
yeah, I have a couple other companies, and we're kind of at the same level. So we do share certain information and I'm on her committee because she just
Mm-hmm.
went through her CHAPS certification. So
Nice.
she used me as a part of the committee. Didn't have to do a whole lot, right? Just to say, hey, this person is on my committee,
Yeah, we
um,
all we all
as
do that.
well.
We all do that.
But as they do the quarterly meetings, then it'll be official. We'll actually kind of get on the quarterly meetings because you
Right.
have to have the minutes. And I'm new, but I knew I wanted to go through the ACHC accreditation.
Mm-hmm.
Um, and it's easier when you're first starting because the five clients that's required, I call patients clients. So the five clients that's required, it's easy to have five than to all of a sudden blow up and you got 20 and now you got to QC 20 clients, right? So it makes sense to do it when you first start it when it's minimal and you don't have to go through as much because I'm still jacked up, right? Because I haven't really been QCing it properly, but I'm going to start going through that process. And then the company I'm dealing with has a mock that you can go through
Mm-hmm.
um, first, with all the things that are wrong. So I'm starting to go through that and make sure I got all my documents and stuff because it's just easy when you're at a minimal level. And as far as the QA program, And you're saying when you were saying that the mistakes, don't shy away from the mistakes, don't get, beaten down by the mistakes, but just learn from it because it sometimes is better to happen when you're just starting out, the bumps and bruises, because now you can
Of
tweak
course,
your SOPs for because once you start getting real busy, you're not going to have the opportunities to do it right, or it's
for
going to be
sure.
shotgun because you're in a faster pace environment. So we had um, a CNA. She was with a client that had a JP drain. The the son and his wife said that they were going to drain the drain. It wasn't even a part of the task, right? Because they said we drain it. You don't have to worry about it. So they called her one of the mornings and say, "Oh yeah, we're getting up late. Can you just drain it?" So she did. And previously she said she's done it before anyway. But a couple of days later, or a day and a half later, I don't know why it was a day and a half later, but he says that, oh, we were changing such and such, and it wasn't properly closed. So there was some drainage. At that point, it was only like zero point 0.8 meters, so it couldn't have been that much drainage, right? But then we looked back and was like, okay, she left at 1 p.m. on a Thursday. He didn't call till Saturday. So what happened all day Friday? Did they not drain it themselves? Because their parents live by themselves. So
Mm-hmm.
maybe nobody came through and did it. It was a
Right,
gap of
right.
time. So I left it alone because it was more of when they told her to do something that was not part of her task at that level of a task, she should have called
Right.
the office first
Exactly. Exactly. Because
and
Mm-hmm.
got
you
the
always want to
approval.
think about liability, right?
Mm-hmm.
Yes.
Where does it put you as an organization? Now you having this person outside of their scope. It's not part of her care plan. And if something happens, fingers and tongues, people's tongues start wagging, people start complaining, and fingers start pointing in terms of, oh,
Mhm.
you did this, your worker did this, and because they didn't do this, this what happened. And
Yeah.
we live in a world where people are very subconscious, right?
Yeah. So it kind of led me, the QA portion of it, I had to look at it and be like, okay, what could we have done better? And we normally do the competency the first day that they're with the client. The nurse will
Mm-hmm.
go out, do the competency checklist with them. So now I was more of, okay, sometimes when clients see you doing a competency on someone that's supposed to be a professional, they already have why are you doing a competency on this person? They don't know their job, right? So I was like, okay, now we'll just do it after orientation. We'll do it in the office with I got a test mannequin anyway, where you can do all the stuff on. I said,
Mm-hmm.
we'll do it in the office now and do that while they're after orientation to get it over
Right,
with. So we don't have
right,
to do it in front of the client.
right,
And then if the client has any special needs, we train on it right then before they go to the client.
right.
I have a
Mm.
quick question. Can I ask a question of Frank?
Sure.
Hi, Frank.
Yes,
My
ma'am.
name is Tamara. I am the owner of Alair Home Care. You had mentioned a couple of certifications, the CHAPS and then the ACH. Can you tell me exactly what that certification is?
ACHC, they're both similar. There's a price difference from one to the other.
You said
Um,
ACHC?
yes,
A
and
ACHC. Okay.
mhm. And the other one is CHAPS, and they're similar, different companies. There's a price point maybe of a couple to a few hundred, I think.
Mm-hmm.
Um, but it's just an accreditation, right? If you're used to the IT industry or something like that, everybody's got a body of people always create an accreditation for something, and
Right, right,
it's supposed to show that you're a cut above with your quality control, right,
Okay.
within your organization, that your policies, procedures are above anyone else's, and you get the nice little seal to put on your website.
Okay.
No, those are all great comments, and Frank, because, you know, unfortunately, sometimes people think because you're only doing private pay, you should not, develop this program. But these are data, measurable, having measurable data information. You'd be surprised, and you know,
Dr.
information
Marcia,
that you're
we're
now
not seeing you.
gathering. Oh, I just muted. I had to plug my computer in.
Okay, okay, sorry.
What state is Frank's agency out of? Just curious.
Maryland.
Oh, okay.
The great state of Maryland.
Okay.
No,
Excuse
I'm
me.
joking.
That
I'm
stands that
from
stands
South Carolina.
corrected.
I'm from South Carolina. I would have said the great state of South Carolina.
Okay.
All right, Dr. Marcia, we're not hearing or seeing anything.
Sorry, I'm back. I had to do technology.
Okay, I understand that.
Sorry, I had to plug my computer in.
Okay.
Any other comments or, suggestions or best practice or questions
I just have a general question about Joint Commission
Mhm.
certification, because I know that some of the insurances really prefer you to have Joint Commission. Do you know anything about that process for home care agencies, non-medical?
Shannon, you want to answer or?
No, I'm gonna let you answer that.
Okay,
Mhm.
so Joint Commission, yes, I've been through Joint Commission. I've been through CHAP for home care agencies. It's, you really do need to they tell you what standards, right? So it's a
Mm-hmm.
cut above your state requirements.
Mm-hmm.
So typically, any type of accreditation bodies, their requirements usually more than what your state requires. So, for example, Joint Commission may say you need, 16 hours. I'm just using that as an example of your home health aide needs 16 hours of in service, but your state may say they only need 12 hours.
Okay.
And you get that even with CHAP. They have all the standards, and now you're going to have to tweak your policies and procedures to fit into their standards. So they give you the standards, you get all the manual, and then you're allowed to put those in place, tweak your policies, and then they're going to come out to see whether or not though you are abiding by those policies and procedures by all their standards.
Okay.
So they have different standards, and you get it and you implement it, and then they come to assess you. And CHAP does that also.
Perfect. Thank you.
You're most welcome.
And Dr. Shannon, I have a separate question for you. Did the SOP thing move to September 24th?
Yes, ma'am.
Oh, okay. I thought so. Okay.
Okay, all right.
I got a quick question. So for CHAP, is there a specific website I have to go to, or what's the procedure?
So for CHAP, you could just type in the word CHAP,
Okay.
and you'll see all the information. They usually, both them and the Joint Commission, they usually have representative assigned for each area. So you want to
Okay.
find out who's that representative for your area based on where you live.
Okay. Thank you so much.
Mhm.
Check the chat, Caroline. Thank you,
Okay.
Ronnie. Thank you, Ronnie.
Oh,
Thank you, Ronnie.
okay. Let me check.
So I'm in the process of, hi, this is Ronnie. I'm sorry. I'm in the process of doing my accreditation. So if anyone has questions, you can feel free to reach out to me.
Oh, okay.
Thank you, Ronnie.
Thank you so much, Ronnie.
Yeah. So just
This
go to
is how we all work together as a community, as an
And
organization, right?
Can
So don't be
you
afraid to share stuff. I think it helps all of us to grow and, in terms of best practice.
Yeah, I agree. I think you really don't have any competition in home care to me. I think, I'm a part of a consortium in Wisconsin, and like they openly share like their rates, they openly share like their challenges, because you don't have enough staff, you have too many clients, and you really are not in competition with each other. You're just trying to figure it out and do the best that you can with what you have.
Right.
So I have shared my information there. So please feel free to reach out to me. I've been operating in business for 5 years now. I mean, I still have a lot of questions about CHAP. And then Frank, if you don't mind share, I just put my email in the chat. The same thing. I'm going to take Rosa's,
Right.
because I have lots of questions. It just happens every day.
So
So,
just to say this for everybody, when you're in the community, just go to members and you could chat with each other within the
oh,
community.
I didn't know that. Okay,
Yeah,
I'll
yeah,
do that.
this chat right there. It's like a text back and forth, DMs back and forth to each other in the community.
Okay.
Okay.
Hmm.
Who said that they were going through the certification? Is that Rosa?
That's
Ronnie.
Rosa.
Rosati,
Okay, I'm
yeah.
gonna definitely, because I want to look at the CHAPS certification. Okay.
Mhm.
Okay. Any other questions for Dr. Marcia?
Oh, great job.
Thank you. And I'm looking forward to next week. We'll talk, I'll make sure we post your homework
Oh,
in the community. So,
I think we could give you permission to post it yourself if you want to do that.
oh yeah, I could do
Y-
that.
Yeah, so Nelva, if you
I
could give
forget
me,
I'm part of the community.
yes. Oh yeah, so
I
Nelva,
could
if you,
definitely do that.
yes, okay. So Nelva will arrange it so you could post it.
Yes.
Okay.
We'll definitely do that.
All right, wonderful. Wonderful, wonderful.
Thank you.
Well, thank you, everyone. It's 8:53, and I know it
Thank
took
you
up a
so
lot of
much.
your time.
Uh,
So,
you mind telling us who Nana is? I don't know who Nana
oh,
is.
so Nana is he's one of my clients. He works with lot with individuals with different types of disabilities, intellectual and developmental disabilities, and he's opening a home care agency in New York City.
Ah,
So
so
I told him about the community while he's waiting for his license. I'm like, listen, you need to join Dr. Shannon's community, so because he's doing non-medical in the interim, so that you could see and learn and be a part of this, wonderful group of folks. I mean, you guys are sharing stuff and all this. You don't get that often.
okay, wonderful. Are you in New York City, Nana, or you're upstate?
I think he's actually in Africa right now.
Okay, so where will he be opening the agency?
It's going to be in New York City, in the Bronx,
Oh,
servicing
okay.
the five boroughs. It's five boroughs and
Yes,
Westchester County.
oh,
Yeah.
okay,
Okay.
okay. All right. Yeah, we could talk privately. I mean, I started as non-medical before I got my license, which took way too long to get, but we could talk
I
about
know.
that.
That's why I keep telling him about you.
Yeah, oh my God, yes. Okay.
Yes, I couldn't unmute. I'm now able to unmute. I'm very excited to be part of this group. Dr. Marcia has been mentoring me, and
Okay, great.
I really appreciate it. She has a wealth of knowledge,
She absolutely
and,
does.
and
Absolutely,
I'm
absolutely.
so excited to be there. I'm in New York, actually Westchester and then part of Bronx. So New York City and New York State. Um, that's where I'm going to start my business.
Okay, that's how I started too. So yes, I started out of my home at first in Peekskill, and then my office was
Oh,
in Mount Vernon afterwards. Yeah, that's how I
oh,
started.
okay.
Yeah. Yes, and I'm
And I
glad that you.
think I think I told him a lot about you.
Oh, you did.
Yes,
Okay. All right. All right.
and I
So
have a
yeah.
book too.
Oh yeah. Oh, which one? I have like 10 books. Which one do you have?
Oh, which one is that? I think I have two or so. Dr. Marcia mentioned it to me. I'm currently not in New York. I'm on vacation in Ghana. And
Okay. Is it Unstuck, the ultimate guide to getting and staying motivated? Is it that one you
yes,
have?
yes, yes, that's the one.
Oh, okay. Okay. Thank
And
you.
then he
Thank you.
has the non-medical home care
Okay,
as
okay,
well.
great. Awesome, 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 awesome. Well, you are very fortunate to have Dr. Marcia as your mentor. She is absolutely fantastic. I've known her 22 years. I want to say 22 years.
Yeah.
Oh no, it's more.
I think it's more than that. I stopped counting. I stopped
Yeah,
counting.
2001. I was working at Co-op Care Plan. Yep,
Yep,
Co-op
I
Care
stopped
Plan.
counting.
Yeah, yeah, 2001. So 25 years. Okay.
Yeah, because I was at Americare then.
Yes, yes,
Yeah,
yes, yes.
yeah, yeah, yeah.
Okay.
Oh,
But I'm only
thank you.
25. I'm only 25 years old, so there you go.
Thank you.
All right. All right. This has been wonderful. Thank you. Thank you. So so we'll have the video up in the community. So we'll have that posted in the community. All right, wonderful. Thank you all. Thank you all for coming. If you
Thank you
have
so
any more
much.
questions for Dr. Marcia, this is the time. If not, come back next week.
Hey, Dr.
Florence,
Shannon, thank you so much. We
you're
really
welcome.
appreciate. So I have a question, just curious. So it's not like so this week, since last week, he has been really challenging for me. I got my provisional license in May. Um and I have a survey last week. I
Oh,
was panicking. I mean, like I don't even know what was going through my mind. So the inspector came in and they spent almost 4 hours. So it came in like 10. It left like 2:30. So I thought, okay, maybe I didn't have everything that I needed. So it looked at everything and he asked me, I can update this, make sure this and whatever. So today, I mean, as of yesterday, so I people tell me like, okay, once that happen, they will just tell you where you need to add more, and they can give a citation, and you can just make that correction, and they can come over and inspect it again. So that was what I was actually expecting. And yesterday, voila, and they got my permanent permit. They sent it to me. So I was so super excited, and and you know how when you have something great coming in, the devil will come with his ugly head. I've been in the ER since yesterday.
oh
After, yeah,
no.
my husband, it wasn't really good, so we had to rush him. We've been here
Mm.
since yesterday, so I just want to thank you for giving me the opportunity to be on this live section. I'm just lying down trying to listen to everything, but I have one question. I'm
Congratulations, by
just,
the way.
yeah, so
Congratulations.
thank you so much. So I'm just thinking in my brain, like, how when we have a registered nurse on our application to get the license. So I have my registered nurse. So I'm just curious, like, how do you now get to medical? What if you're doing non-medical, since you already have all your process and everything, is it harder to now do medical as well? And do you have to have medical and you have to wait for certain period of time for you to have if you have non-medical, do you have to wait certain period of time to do your medical? I'm just curious. So I don't know if it's something harder, or it's just a couple of steps to add on to what I've, for non-medical.
Okay, I'm not sure that I understand your question fully, Florence. So you were approved, and on your approval, you're able to provide nursing. Is that what you're saying?
Nursing companion and um nursing companionship and one other things, three. Um so
Personal care?
yeah, personal care. Yeah. So the question is, so people that does the medical, right?
Hmm.
Since you already have non-medical, is it harder to to transition to medical, or is
All right.
just is
If I'm not mistaken, you're in the state of Georgia, correct?
yes, Atlanta, Georgia?
All right. So when
I'm
you're
just
saying
curious.
medical, I'm sorry, say it again.
Like the skill nurse.
Like the I didn't hear
Skill.
that one.
Skill.
You know
Oh,
how when you
skill.
have
She
like
said.
the medical part of it, you have non-medical and medical, right?
Right,
Or
but
yeah.
okay.
Is it
So
hard?
you have home care and you have home health, right? So it sounds like you're talking about home health.
Oh,
So
okay.
that would be a different process. That
Oh,
would be a
okay.
different process, right?
Okay.
'Cause
So
once
it's
you're
totally
approved,
different.
right? Because once you're
Oh,
approved as
okay.
home health, then you could it's a part of
Okay,
like
okay,
a
okay.
Medicare process, which what you are, you cannot bill Medicare. So it's a different
Oh,
whole process. It's a whole process.
oh, okay, got you. I was just curious, like,
Yes.
Okay, thank you.
You're welcome. I'm sorry, Dr. Marcia.
No, 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 no.
So, Dr. Shannon, when you are skill, right? Can you provide non-skill as well, or it has to be specified as just skill in nursing?
When you're skilled, what the average home health agency, either they have another component of their business that
Okay,
provides that,
gotcha.
or they're referred to another company. So
Okay,
if right, so if you should befriend your home health agencies in your area, right?
right,
So
right.
if your clients get to the point where they need skilled care, you refer to them. And if they have
Okay,
clients who don't really need skilled care, they can refer to you. So you're not competing, you're supporting one another, should be the goal.
okay.
Mhm. Okay. All right. Any other questions for Dr. Marcia? And keep in mind, guys, once you're in the community, you could chat amongst yourselves in the community. Just find the person's name, just click on members, type the person's name, click chat, and it's a private conversation. Once you're doing it in chat, it's private. Only when you do posts, it's public. Okay?
Yeah. I'm
Okay.
No, no
actually
problem.
in the community, just so that everyone knows.
Yes, you could talk to Dr. Marcia as well directly if you need to. Okay, Ronnie. I see you,
Ronnie
Ronnie.
had to
Thank you.
leave.
Yeah, Ronnie had
Yeah.
to leave. Thank you. All right. This was wonderful. This was wonderful. So we'll be back next week, Tuesday.
Awesome.
Um,
Yeah.
so we do have our Q&A tomorrow midday, so please join us tomorrow. Dr. Marcia won't be there, so you just send all your questions to her via chat and she'll respond there. All
Yes,
right.
I will. I
All
will.
right. Thank you. Thank you all. It has been wonderful. Thank you, thank you, thank you.
Thank
Have
you
a
so much.
have a great evening, everybody. And
And
those of you
thanks
who
everyone. Thanks for having me.
yes, no problem. Thank you. Thank you for being here. And those of you who registered for the owner freedom framework workshop, it's no longer tomorrow. It's going to be the 24th of September. That was posted in the community, but I should have tagged all of you. It was posted a few weeks ago, but I didn't tag you, so that's why you didn't see that. All right, so have a great evening, everybody. Have a great evening.
You
And I'll
too. Thank
see.
you.
You're welcome.
Okay.
Drusilla, so good to see you, Drusilla.
Good. Hi, Dr. Shannon.
Good to see you.
Yes, good to see you.
Yeah. Well, good to see the D, but just glad to know. So glad to know you're there. So glad to know you're there.
Thank you. Oh, no.
Okay. All right. All right. So we shall talk soon. See you tomorrow at 12 noon Eastern time. Eastern time. And Nana, feel free to join us tomorrow, Eastern time.
Thank you. Thank you.
Okay. You're welcome. All right.
Have
Have
a
a good
good
night,
night.
everybody. Have a good
You
night,
too.
Good
everybody.
night,
Good night.
everyone. Bye
Good
bye.
night.
Good night. Hi, Scarlett. It's my first time meeting you. Scarlett.
Hi, Dr. Shannon.
Hi, can I see your face? Okay. I see the bright light. Why are you laughing? Why are you laughing? The bright lights.
I'm
Thank you
just
so much.
kind of surprised.
Wait, say it again. I didn't hear you, Scarlett.
I'm just kind of surprised.
Oh, that I called your name? Oh, okay.
Yes.
Good to meet you. Good to meet you.
Uh, nice to meet you too.
All right. Okay, ladies.
All right, take care.
This was a great session.
Yes.
Excuse me.
Let me end this and I could call you back.
Okay, all right.